I would like to summarize to you the holistic or integrated type of oncology we are doing in our center. Usually we believe that treating the cancer cannot be realized only through chemotherapy, which the orthodox oncology thinks the only thing to do in stage 3 or 4 patients. What we are doing, let us consider the disease here in the center. This is the cancer we have to treat. This is a 3rd or 4th stage cancer. Of course, we start again with chemotherapy, but now this is insulin potentiated chemotherapy. As I have summarized in another lecture, insulin potentiated chemotherapy uses insulin to obtain hypoglycemia, and at that level, chemotherapeutic agents are much more efficient, even at lower doses. So, the first method is the IPC, or insulin potentiated chemotherapy. Second to that, we use hyperthermia. Again, we heat the body or the diseased organs with this method. There are 2 types of hypertherapy, local and whole body. So according to the disease state, according to the metastatic situation, we use either local hyperthermia or whole body hyperthermia. After that, another important topic is diet. There are foods which are helping cancer to progress, and there are foods which are against cancer. So we must benefit from this. Usually there are many plants, many vegetables which are very helpful in the fight against cancer. So, and another important thing is the glucose containing, or the sugars in general, are very nuisible, very bad for cancer. They cause the cancer to progress. So we advise the patient to have a diet without carbohydrates, or very low carbohydrate diet, and we advise also a diet which is rich in vegetables, rich in fruit and olive oil. And like, if in summary, we advise the patient to use a low carbohydrate Mediterranean diet. The 4th advice to our patients is nutraceuticals. Many plants have substances which act as cytotoxic agents on the oncogenes or other metabolic pathways in the body. Especially, we can give examples like curcumin, which is found in cruciferous plants like cabbage, broccoli, etc. Curcumin. Then I advise omega-3 oils, fish body oil, which are rich in EPA and DHA, eicosapentaenoic acid and doxohexanoic acid. And both these essential fatty acids are good in fighting against cancer and against the inflammation, which is at the root of cancer. Then there are many others, and so we give the patient a list of this type of nutraceuticals. Then we advise the patient to do some movements, some gymnastics, you can make some sport, as walking, swimming, or other types of cycling, etc. And then also the moral value of the patient. psychology of the patient is very important. If the patient is a positive person, if he believes in the treatment he is doing, his chances of having a good response are high. But if the patient is somebody depressed, having no hope, then his chances are weaker. So we make every effort so that these patients have a support, psychological support, and turn them into a positive thinking people. So as you see, to fight cancer, only chemotherapy is not enough. All these procedures together, that means that can be said in summary that you have to live in another way. You have to change your way of living to fight against cancer.